Hey guys, you're watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all across the country. And if you're paying attention to what's happening with the oral systemic link, you know there's a big talk and big chatter about this. And I've got one of the world's experts on today, Dr. Amy Doneen, and you do not want to miss this. So do me a favor, grab a pen and hit the share button. We'll see you in a few seconds.
The Best Practices Show with Kirk Behrendt is brought to you exclusively by ACT Dental, the ultimate provider of dental practice management solutions for dentists and their teams. ACT Dental is committed to helping you build a better practice and a better life. If you're looking to grow your production, motivate your team, get back on track, and create the practice you've always dreamed about, look no further. Give us a call at 800-851-8186 or visit us at actdental.com.
Hey guys, welcome back to the Best Practice Show. Thank you so much for watching, and thank you again for all your suggestions. Having so much fun doing this, and some great topics and great subjects on the horizon. And today is no exception. You're going to love this. One of the hottest books in all of dentistry is Beat the Heart Attack Gene. I've got one of the authors on today, so you're not going to want to miss this. Now, a couple show notes before we get started. We are shooting this live on Facebook. So if you have questions and you're watching the feed, do me a favor and add questions to the feed, and we'll make sure we get you the right answers, because we want you to get the most out of this. And then also, if you're watching these later on and it's not live, continue to add your questions to the feed, because you'll see there'll be a lot of people that will chime in, and we'll ask Dr. Doneen to chime in. And again, we want to make sure you get the most out of this. Now, my guest today, Dr. Amy Doneen, is one of the brilliant people behind this research, and I just love it. I absolutely love it. We had Dr. Bale on a little bit earlier in the season, and you're going to learn this. But today we're going to be talking about a new look at the oral systemic connection and how it plays a role in beating heart attacks and strokes. Now, Amy, if people don't know who you are, I know who you are. Can you tell us a little bit about you, who you are, what you do, and before we jump into all this?
Sure. Well, for one, Kirk, thank you for having me. I'm so excited to be here. So your show is amazing, and it's new for us in medicine, by the way, to be involved in these podcasts. So it's very exciting and amazing, the audience that you reach. So thank you for having me.
Our pleasure.
Thank you. Well, I am the medical director and owner of the Heart Attack and Stroke Prevention Center in Spokane, Washington, and I am the co-owner and founder of the Bale-Doneen method with my colleague, Dr. Bradley Bale. We have, for the last 17 years, sought out to prevent heart attacks and strokes in our practices. And we have long sought out to try to find every root cause we can of vascular inflammation. And as we sought out clinically to do that, we realized that if we didn't address the inflammation that can be caused by periodontal pathogens and unidentified silent asymptomatic endodontic lesions, that we could treat these people medically to the best of our ability, and we would miss their inflammation that's driving the disease silently. So we really put on a strong front just with the two of us to try to get this data published and get it out there. So those in medicine who are practicing prevention recognize the contribution of dentistry to the world of heart attack and stroke prevention.
Yeah, absolutely. And I want to talk about why this is so important, but let me start with this. If you haven't purchased the book, you have to, because it's so good. And now tell us how the book was born. You know, obviously you wanted to get this research published, but tell us a little bit about the process behind the book, because it's called Beat the Heart Attack Gene. You're going to love it if you're a dentist. If you're a team member, you're definitely going to want to read this, because it starts to connect the dots in a different way than what you might have heard before.
Sure. Well, thank you for that. The book has an interesting story. It was kind of cathartic for us to even begin the process of thinking about writing the book. The first thing we knew is that we had to identify our target audience. Was our audience going to be the provider, or was our audience going to be the public? And we decided early on that the audience really should be the public, but the information in the book should be backed by the recent research, so that the individual healthcare consumer, whether they're in medicine or dentistry, had the information so that as they took it to their own providers, they were not vulnerable, that they had the science with it. So even the whole concept of the book took a thought process. So now that we had identified our target audience, which was the healthcare consumer, we thought, how are we going to do this? What's the most readable way we can get people to actually continue to turn the pages? So with the gracious support of our patients, they offered their own stories through this book. One that's particularly telling through the book that hits the oral systemic connection is a individual in the book who is a periodontist herself, who I met. She was a patient presented to me after she had a stroke at the age of 37. Young, fit, extremely healthy, thin, non-smoker, and she was in the middle of her day and had a stroke. Actually diagnosed it herself, left the operating room, she's a periodontist, took a couple aspirin, went into the hospital, got a full traditional workup, and they said, well, we're not really sure what caused it. And so bringing her in, she came in to see me after her event, looking at all the root causes, and believe it or not, periodontal pathogens could care less what the initials behind your name are, right? So you don't, if you're a dentist, it doesn't exclude you from having periodontal disease. And that's indeed one of the many root causes that this individual experienced. So she was so gracious as to share her story. And I think as people read the book, even reading her own personal story gets people to understand. And so throughout each chapter, as we would highlight an individual patient's story, we then put all the references because we're very evidence focused. Nothing we say has an opinion. Everything has the science behind it. But we chose to put the references at the back of the book in each chapter. So it was a readable story, but yet extremely scientifically evidence-based. So there's over 900 references in the book. And even Larry King, who wrote the foreword for our book, was quite touched by that as well. And he after he was done, he said, well, why wouldn't everyone assume that they're at risk for this? Because perhaps if we all assumed that we were at risk for the leading cause of death and disability in this country, which is heart attack or ischemic strokes, why wouldn't we all take life a little more seriously? Why wouldn't we go to the dentist more often, ask to be screened for periodontal pathogens? Why wouldn't we want to take better care of ourselves? So the book, that's how it started. The other key point here, I think, is that we needed to identify ourselves because I am a doctorate prepared nurse practitioner. Brad, my colleague, is a doctorate prepared family practice doctor. So we are not trained in traditional cardiology. So when we talk about heart attack prevention, there was a lack of understanding of even who we were. And so I often explain it like this, Kirk. I say, look, traditional cardiology is focused on the blood flow. So if you think about a garden hose, you think traditional cardiology is the water flowing through that garden hose. My expertise, my training, my focus, everything that I do every day is focused on the health of the actual hoses itself. Are there any cracks in that hose? Or is there any vulnerability in that hose? Because what traditionally causes a heart attack or an ischemic stroke is plaque that's hiding in the wall of the artery that can rupture. And the body's automatic autoimmune response to that is to send in all kinds of clotting factors to heal it. And if that clot happens to land in the heart, we'll call it a heart attack. If it lands in the brain, we'll call it a stroke. So we needed to identify ourselves who we were. So we came up with the word, actually, arteriology, which is the study and focus of the artery wall. And we feel that our dental colleagues are also arterial wall specialists. They just maybe haven't been recognized as such. Anyone who has the ability to identify causes of vascular inflammation is practicing arteriology. They just sometimes don't get their due credit, but they're really specialists on lowering inflammation in the artery wall. So that was the second thing we needed to do through the book. And the third thing really with the book is we didn't want to self-publish. We really wanted to go through the rigors of finding an agent, finding a publishing house, because we don't own the book. Even when I buy it for my patients, I have to order it off Turner. I do. And that was important to us because I think it made the quality of the book better. Not quite as rigorous, obviously, if you do a peer peer-reviewed journal, like we did with our recent publication in postgraduate medicine and have done with others. But still, it forces you to really make sure you're doing a good job and not just publishing your own opinion.
Yeah, it's awesome. So very well said. Now, if I'm a young dentist, tell me why you guys have such a place in your heart, no pun intended, for the dental community. Like, let's go a little bit more specific in this, because this is such an important thing. And as you and I were talking before, when discussing the systemic link, a lot of the conversation many years ago was it could influence this or maybe linked to this. And now we don't have to do that anymore. Now we can say it's directly linked. And so can you speak on both of those?
Oh, I'd love to. Sure. First, let me explain one thing, and that is, how did we get to the idea to value the importance of dentistry in our work? So a very simple idea on how we're different than standard of care. Standard of care is going to treat you based on risk factors. So in the world of medicine, I'm either going to offer treatment for you for the prevention of a heart attack or not, based on your age, your gender, your smoking status, your cholesterol, and your blood pressure. And that's it. And if all those look good, you're fine. If those look terrible, you're not. And you get thrown into a gamut of all kinds of treatment. What we decided years ago is to understand what really causes a heart attack. And it's the presence of plaque in the artery wall. And it's that plaque that can be inflamed, as I said earlier, that can rupture. So what we did is we paused there and we said, okay, what are all the root causes of vascular inflammation? And we identified many, Kirk, including lipids. Of course, cholesterol is a root cause. Of course, blood pressure is a root cause. But you know what? So is psychosocial. So is periodontal pathogens. So is endodontic disease. So is obstructive sleep apnea or disturbed sleep. So is genetically inherited lipids like lipoprotein A, and I could go on and on. So we're naive in medicine to think it's just cholesterol or just blood pressure, not to say those aren't important. So then as we started to look at the data associated with periodontal disease, we were a bit frustrated because there was all this sort of individual little data sets, the INVEST trial, all these little things that came out to say, my gosh, if you have these pathogens, things are not good. There's blood pressure quality issues. There's lipid dysfunction issues. There's all of these things going on. And in 2012, when the American Heart Association, the American Periodontology Association published a joint statement, they said the following. They said what goes on here is associated with heart health, with level A evidence, which is really terrific evidence. But they paused short of stating causality, which was okay at the time, because even the definition of periodontal disease still today doesn't include the pathogens, right? So I can appreciate where they were. And that was actually a really bold move, and I appreciate it. But what Brad and I intended to do with our colleague, also Dave Vigorist, who was our co-author on this paper, is to say, okay, let's do a massive literature search. And let's use a model called the atherogenic triad, which are three things that have to occur, Kirk, in order to develop plaque in the artery wall. The first is a concentration of cholesterol floating through the artery. The second is a vulnerability of what we call the tennis court, or the endothelium of the artery, so the very inside lining. And the third is actually allowing those lipoproteins to get trapped in the artery wall, which is actually the first step. So it's a little bit reversed. But those three things in tandem or simultaneously or on a continuum need to occur. And there's lots of things that can cause that atherogenic triad to be activated, one of which are periodontal pathogens. So what we sought to do is dive into the literature, look at the dangerous pathogens like AA, TD, TF, TD, and FN, and say, how do each of these affect that triad in their own way? And by doing so, then we were finally able to demonstrate and come to the conclusion that periodontal disease, described by the identification of high-risk pathogens, is causal of atherogenic changes in the artery wall. Finally, giving dentistry due merit, I would say, in the world of medicine, to say it is key I don't care how pretty your cholesterol is, how pretty your blood pressure is, how thin you are, how fit you are, how not fit you are. If you smoke or don't smoke, if you have periodontal pathogens, you are at risk.
Right.
And so that's we concluded.
Yeah, absolutely. Absolutely. Now, because this is one of those things when you're a dentist and you're thinking about what are some of the things that you would ask dentists given this information, like how do I start communicating with my patients? Where would you start? Because some people are going to watch this and go, I get it. I totally get it. Yeah. But Dr. Doneen, give me some suggestions. Where do I start? Obviously, I could read your book, but what would you ask or what would you tell a young dentist? Because we have dentists that are in dental school watching this now. Right. What are some of the things that you would pay attention to?
Well, the first thing is education. So the most powerful weapon we have in order to change the world is through knowledge and education. That is it was quoted by Nelson Mandela, actually. And so I'm always a firm believer that we must educate ourselves first. And I'm learning every single day. I have so much to learn in this. And so one ask I would have of dentists and dental hygienists is to get the article. Go to Postgraduate Medicine. It is published open access, Kirk. And the reason we did that is we wanted everyone to have access. And we're also asking that our dental colleagues go in and get it. Click on it and get it, because what it also tells a medical journal, Postgraduate Medicine, is that people care about this information. If we were to just blindly hand it out and they're not seeing how many people are wanting it, they're not going to ask for more publications in this arena. So number one would be get the article. Download Postgraduate Medicine. You can put Doneen, you can put Bale, you can put periodontal pathogens in your search bar. It comes right up. Download it, read it, understand it well enough that you can take it home and start talking to your family. You all of a sudden it becomes conversation, not some nuance thing. So once people understand it well enough to just talk about it, then bring it to your patients. Tell them about it, especially your patients that have had a heart attack or stroke before. Say, gosh, we know there's data now to say periodontal pathogens are causal of atherogenic changes. So what's the next step? Measure the pathogens, right? Yep. Because a lot of dentists aren't even yet adding that into their definition of periodontal disease. We're begging those two steps. One, get educated, and two, start measuring the pathogens in your clinical scenario. And what's funny to me is dentists say, you know what, Dr. Doneen, I don't need to do the pathogens. I mean, we're doing everything we can here anyway. And what would it matter? Well, it does matter, because each of those pathogens has a different role in the atherogenic process. Let me give you one example just to make this very, very clear. If someone's walking around and their gum line looks pretty stable, no bleeding, even pocket depths that aren't dramatic, if they're harboring, I'm just going to give you one example, PG, right? PG actually can cause those lipoproteins to get trapped in the wall of the artery. And if that's the case, then even though the lipids may look pretty, blood pressure may look pretty, gum line looks pretty okay, those pathogens, as the cholesterol gets through the endothelium, gets through the intima, gets through the media, it gets trapped within that intima media and starts to form fatty streaks. So if you're 20 years old and you're starting to see atherogenic changes in the artery, by the time you're 40 or 50, you're going to have plaque in there. So we're begging our dental colleagues to monitor the pathogens. And I hope that when you start looking at the pathogens, that everyone in your clinical practice has none, because it does suggest, that your treatment is working. And I would softly challenge the dentist then to say, if you are seeing pathogens present, the dangerous 5, as I call them, in your clinical practice, pause and say, what are our protocols here? Because there's no standardized protocol on how to treat pathogens as a whole. There's different I think, clinical protocols, which are great, and we celebrate all of them. And we're not here to tell you how to treat them. We're just begging you to recognize them. Does that make sense?
Makes perfect sense. And a lot of times
for help.
Absolutely. Well, this is a great conversation. I love the. And a lot of times when we talk about the oral systemic link, we're including, hygienists, dentists, and periodontists. But let's go into the endodontic. When we talk about endodontics, can we just address that for a little bit? Because you have a whole section of knowledge on that. Just can you
Sure.
talk about that?
Well, one of the most, in my opinion, the landmark trials on that was Dr. Pesce, who published it. And he looked at individuals going into the hospital with a heart attack. And they said, do you feel okay? And they're like, well, no, I'm actually having a heart attack, right? These patients are in the emergency room. And they asked, do you have any teeth pain? And they were like, no. And Pesce actually asked, well, when you go into the cath lab, do I have your permission when the atherogenic clot is removed from your arteries? Can I look at it? Right. And what he was able to demonstrate is that within the thrombus that was actually causing the blockage, there was the strep viridans, which is the very common bacteria causing periapical abscesses. And in these people who were randomly selected, 30 out of the group that were randomly selected to do a 3D cone beam evaluation, 50% of them had asymptomatic periapical abscesses. And so what we ask our dental colleagues to do is we want two things. One is to get educated, realize your work matters. It matters dearly for life. For life. It's not just a pretty smile, it's to save a life. And so how do you do that? One, you measure the pathogens, and two, you do a 3D cone beam image because the sensitivity and specificity of that out-predicts any 2D film. I don't even care if it's digital. It's like a 50-50 toss-up, the sensitivity and specificity there. So we're asking for patients that have a history of old root canals or endodontic treatment to at least know if there's anything going on, and we ask for a 3D. We're not against root canals at all. We're just saying make sure they're okay.
Yeah, I need like 3 hours with you because I have so many questions, and I know I only get you for a little bit today, but I want to ask you like the big important questions because we have so many dentists watching this and helping them understand that and I want to ask you your perspective. We're passionate about dentistry, but a lot of times dentists have been looked at as the final pioneer that can truly help this country or the world be a lot healthier. And we talk about inflammation. Like, let's go there. Like, we're a world of more information. You think this country would be getting healthier. You think people would be coming in with less disease. How much of inflammation starts truly here and affects the rest of the body from your perspective? And speak to the dentist being the keeper of that gate.
Sure. So I can't speak to how much of heart disease is driven by periodontal disease through the pathogen burden or endodontic. What I can, because that data has not been published, what I can tell you is that it's without question a contributory cause. So that we know and that we stand very firm on. What intrigues me, though, is the amount of people that have periodontal disease. Your statistics in dentistry shock me. Over 70% of people over age, 50 or 60, have some sort of chronicity of periodontal disease. And here's the reality. Every 35 seconds in this country, someone's having a heart attack. Every minute, someone is dying from one. Every 4 minutes, someone's dying of a stroke. I mean, let's look at this reality. Stroke is the number one cause of disability. So when we look at just being human, what is our biggest risk factor of dying or being disabled? It's actually a heart attack or stroke. And yet, we all walk through life assuming it won't happen to us. No one, Kirk, says, oh, next Saturday I'm wide open, the Hawks aren't playing, I think I'm going to have a stroke then. It's a good day to have a stroke. No one thinks it can happen to them. And if we know that periodontal disease is a contributory cause to the leading cause of death and disability in this country, wouldn't we celebrate that in the world of dentistry to say, wow, we have a big role here. So why not check for pathogens? The data's been published.
It's awesome.
Published.
It has been published. Yeah. So I know you have to run, but if people want to get a hold of you, how can we get a hold of you? How can we ask you questions? Where can we find the book? Just guide us to that, and we're going to have you back on another show.
Well, wonderful. So I would go to our website, which is very simple, baledonine.com, and you can access us through there. Our emails are there, and also there's a lot of information on that website. Also, you can get the book directly by going on Amazon is the easiest way. It's available electronically, for your webcasters that want to listen to it, also in print as well. So yeah, we just want people to get educated. And then the third ask I would have is, please get the article, please read it. If it doesn't make sense or you have challenges with it, email us and let's talk about it. Let's do a lunch and learn with your office. The other thing I want to say is the data continues to come in. On Wednesday, I gave a lecture in the evening, and I talked about a brand new study that was published last week talking about the periodontal pathogens in the role of coronary disease atherogenic burden. So yet one more paper that just keeps coming to validate this message. So people in medicine need help, and we need help from our dental colleagues. So one anecdotal thing, and I want people to understand this, when I call a dental office, here's what I say. Hi, I'm Dr. Amy Doneen. I have a patient here who has atherosclerotic inflammation, and it's going beyond the ability of things I know how to treat. I know how to treat a lot of things in atherosclerosis. I'm great at lipids, great at blood pressure, pretty good at psychosocial, pretty good at diet and exercise. But there's inflammation coming from something that's beyond my control. I need your help. And sometimes they say to me, well, this patient has minimal bleeding, they're stable. And I say, with all due respect, I get that and I appreciate that, but I want to know their pathogen burden, because I'm seeing endothelial inflammation. Their LPPLA2 is up, their HSCRP is up, microalbumin, creatinine, urine ratio is up. My only choice is to increase their drugs, increase their treatment. I want to know where this is coming from. And I think based on the data, it's coming from perhaps periodontal pathogen burden. Can you please check those for me? Mm-hmm. So that's what I ask. And I could, one last thing, sorry, I'm chatting your ear off, but one last thing is I could check the pathogens. It's not hard. It's a swish, blah, 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 send it off. And I could get this beautiful report. There's 3 different companies that look at these things. I could get this beautiful report, but here's the kicker, Kirk. I don't know how to treat them. I'm not a dentist. I have no way to know how to treat this stuff. So I just recognize its value. So I made a choice several years ago to not test for pathogens, because if I test for them, I'm liable to treat them, and I don't know how to do that. So I really work hard at the front end to try to get all of my patients, all of their dentists on board, so that at the end of the day, they are identifying the pathogens, and their hygienists and their whole team are going after them. And I want a follow-up study to know that those pathogens are resolved. And maybe they have other things. Maybe they've got insulin resistance and all kinds of other things that I'm going after treating. But dentistry is an equal root cause to everything else. I just can't do it by myself. I need help.
Yeah. Well, you are doing it, and you're doing an amazing job. So I'm so grateful for even the time you gave us today. But again, we're going to have you back. And also, too, you guys are going to be with us at the ACT Dental Mastery Summit, which will be next year in Napa. And we're just so grateful that you're going to be presenting the information there. So if you're looking for a great opportunity to get away with your spouse, significant other, and get world-class information like this that could change your life forever, that is the place. So Amy, thank you so much. I really appreciate this. And stick around while we say goodbye to everybody else here for just a second. But thank you guys for watching today. We really appreciate this. And as you can see, we're passionate about this information. Hope you enjoyed it. And if you did, do us a favor, just hit the share button, share it with your friends and colleagues. We'd love this information to get out. And until we see you next time, keep watching the Best Practices Show. You guys have a great rest of your day.